All right. So yeah, as Julia said, welcome everyone. So my name is Abby McRoberts, and I'm the communications coordinator for the PEI office, the Lung Association of Nova Scotia and PEI. So for our webinar today, we're going to be going over our findings from the Exploring Youth Nicotine Prevention and Cessation project. All right, so a bit about our project team here. So we have Julia Hartley, who is our PEI Director of Operations, myself, Communications Coordinator, and we would also like to thank the PEI nursing students and the health promoters from the Chief Public Health Office for their contributions. This project would also not be possible without the PEI Alliance for Mental Wellbeing, and specifically their innovation grant for 2022-23. In line with the Alliance's mission, our project aims to strengthen and enhance factors that build resilience in youth, specifically ages 11 to 21. So our project aligns with the purpose of the Targeted Investment Grant, as it aims to create evidence-based recommendations to build awareness and advocate efforts for policy changes or system-level changes for youth to access programs and services on PEI to support them living a nicotine-free life. So just a bit of background on youth nicotine use in PEI. So given that vaping has gained significant popularity in the last few years, there's 39.3 of Island students from grades 7 to 12 said they've used these products in the last 30 days. We're also seeing a rise of smoking among Island youth, with a 4% increase among high school students over the last 2 years. So this comes from 11.8% in 2015 and 15.8% in 2017, and that is now double the national average, which is 7.9%. We also want to give a background on nicotine and mental health. So given that vaping products have only been around for the last 10 years, we still don't fully understand the long-term effects that these products have on our health. However, there is substantial evidence between the connection of mental health and nicotine use. So from the US Surgeon General's report in 2016, this showed that nicotine harms the developing brain, including making young people more susceptible to addiction. And with the brain still developing until the age of 25, exposure to nicotine can harm brain development, affect a person's ability to learn and make decisions. Just continuing with nicotine and mental health, from some recent research done, it says 90% of young people who quit vaping feel more in control than when they were vaping. And then 47% feel less stressed, anxious, and depressed after quitting vaping. Youth also don't often realize that the use of e-cigarettes can worsen symptoms of depression because they're getting a little bit of instant satisfaction. They don't realize the long-term effects. Our first goal of this project was to increase the knowledge of the gaps and opportunities in PEI nicotine prevention and cessation programs and services for youth ages 11 to 21. And our second goal is to increase awareness of the factors that help youth in PEI live a nicotine-free lifestyle, while also trying to mitigate the toxic stress caused by a nicotine addiction. So just a bit about our project objectives. So by creating a better understanding of the challenges and barriers that youth and young adults encounter when trying to make a quit attempt, our project highlighted the opportunities for improvement to help young people who are addicted. In addition, our project explored the experience young people have who were successful in breaking their addiction and how we can better support positive change in our community. And lastly, our target audience, cessation interventions targeting youth aged 15 to 19 were particular interest, as this is a critical period of experimentation and development of regular smoking behaviors. It said that 80% of regular adult smokers began using tobacco before the age of 18, and the average age of vaping onset in PEI is at 15.7 years old. So now I'm going to pass it over to Julia, who's going to go.
Sorry, I'm just changing something up. Sure.
Yep.
Perfect. Thanks, Abby. So I'm going to go through the 4 research components that we used for this project. So first of all, we had a community asset map. We had an analysis of our interview project that was done earlier in 2022. We had a survey and we had a literature review. So for our community, I'm just saying somebody. Sorry. So for our community asset map, we look to identify the gaps and opportunities in programs and services for youth in gaining skills and knowledge in either to stay nicotine free or to break their addiction to nicotine. So that's referring to the prevention and cessation side of things. So we looked both from within the healthcare system as well as outside the healthcare system. We are aware that there isn't a whole bunch of youth cessation programming out there. So we really looked beyond that, at what other services that, are available for mental health in youth that might be available for youth who are looking to quit or stay away from nicotine products. Just give me 2 seconds. So here's a list of all the organizations that we connected with. They were able to, there was obviously a range here, not just inside of around cessation, but outside. So we conducted surveys and interviews with each of these organizations to better understand the services they provided. Our second research component was exploring our interview project that took place in 2022. So our interview project was originally funded through the Catalyst grant, through the wellness grants with the Chief Public Health Office. And we recorded 20 30-minute interviews with youth aged young adults aged 18 to 24 about their experience trying to quit vaping products. And we coded these and identified themes. And then for this project, we kind of did another step of analysis on those interviews to better understand the motivations of youth. So as I stated, we really tried to connect directly and understand the voice of the youth and the target population in these interviews. So we're looking at people who are successful in breaking their addiction, so we can help better support positive behavior change in our community using more of a resiliency lens. So who had quit and how they've been successful. Our third research component was a survey. So we surveyed 85 island youth aged 16 to 21 about their experience trying to quit nicotine. And our criteria was that they were either currently vaping or that they had quit vaping. And I'd like to say we did experience some challenges. Our initial target was higher than 85, but it is very challenging to get at this target population, especially with some of the issues that Facebook and Instagram have about blocking tobacco content. So we were a bit creative and we did some in-person events to better recruit our youth. And here's a picture of Janessa, one of our summer students at UPEI, recruiting youth to participate in our survey. So from our survey, we had, 57.6% female, 40% male, and 2.4% from who identified as another gender. We also had a representation from across PEI. And this is due to the nature of social media and really helping us, to target those outside of just Charlottetown and Summerside. So it's kind of nice to see that rural representation. So as I said, our criteria was basically around vaping. However, we did ask participants what their smoking behavior was. And this was actually quite a bit higher than we thought. So we had 21.2% currently smoking. And as you can see, other ones had experimented with tobacco. So this was quite high, as typically we get the message that youth vapers are specific, whereas we're seeing a lot of dual use in our survey population. Oh, here's just a recruitment ad that we used, and we were given $10 gift cards for their participation. Okay, and finally, our fourth research component was a literature review on evidence-informed youth prevention and cessation interventions. Okay, and so from these 4 research components, we went on to make 4 recommendations. And I'd like to say that, we used evidence to inform each of these recommendations. But I think that as we move forward, we want to consult with more of our stakeholders to better understand how we can either tweak these recommendations or how we can move them forward. So our first recommendation is around the expansion of the youth cessation, of the PEI smoking cessation program. The PEI smoking cessation program currently helps PEI residents interested in quit smoking access free nicotine replacement therapy for tobacco and dual use. We're very thankful to have this program and for the Chief Public Health Office for prioritizing smoking cessation and being a leader in providing these services. And I know that Dr. Spafford and his team is very committed to expanding the program to include vaping and specific targeting around youth and other priority populations. So that's our first recommendation. And I'm just going to go through some of the evidence that kind of led us to that recommendation. So in our survey, I'm going to just clarify that, we did have a small sample size responding to this question, but, 50% indicated that they're currently trying to quit vaping products. So, youth and young adults are interested in quitting. This was consistent with our survey that was done in 2020 that showed that 56.8% of Islanders who vape, 16 to 24 had tried to quit in the past. So this is, quite high. Some of the motivations for quitting that we found from our interview project were wanting to improve their physical health, wanting to save money, that they found they spent a lot of money on vaping or thinking about vaping, and wanting to improve their mental health and stress. So mental health and stress are a key theme that you're going to see coming up again and again. And I think that it really notes that connection between mental health and addiction and nicotine. So some of the motivations for initiation from our interviews were, it's the social norm among friends, it's easily accessible and easier to conceal and be able to vape in indoor spaces. So in reference to the PEI smoking cessation program, we were really surprised to find that 94% of youth aged 18 to 24 were not aware of services on Prince Edward Island to assist individuals quitting vaping. So that was surprising to us. And here is just some of the areas that youth from our survey were looking at that they would like to see the PEI smoking cessation program expanded to. So, having online counseling, support groups, in-person counseling. And I think a key theme that keeps coming up is that youth are looking for specific services that for them to connect with others in their own target population around this issue. They see themselves as very different from, say, an individual who's been smoking for 30 years. They see themselves as very unique and looking for maybe some specific supports to meet their needs. So similar in our interview project, we found similar findings around the need for support groups, one-on-one support from healthcare professionals to create quit vaping action plans came up, as well as coping strategies to manage cravings. They were also looking for free apps and resources to support them and further educational resources. So just a recommendation through our asset map on this area. We just kind of wanted to highlight some of the services that are currently available and how we see that maybe the PEI smoking cessation program or programming on PEI could be expanded. So there's currently the STOMP project that's happening as a pilot in 2 intermediate schools, Queen Charlotte and Hernwood. The Lung Association has our Youth Vaping Awareness Days program, which we continue to run to grade 7 students across the island. So we were able to reach, I believe it was 90% of the schools this year. And the Chief Public Health Office recently developed a program guide for youth and young adults that has not been implemented yet. Okay, so our second recommendation was utilizing existing mental health programs and services targeted to support youth to manage stress and anxiety using healthy behavior lifestyle management techniques. So our interview project identified the need for services to support youth to manage stress and anxiety and depression in healthier ways. Here's just some quotes from some of the youth that we connected with, really talking about that, that relationship between the anxiety and stress, how, vaping can be used to manage feelings of stress and anxiety, but then also create stress and anxiety in one's own life. And from our asset map, we did identify quite a few services, such as the student well-being teams or the mental health walk-in clinics that could be available for youth who are looking for help with stress and anxiety. However, some of the gaps that we saw were that many of the mental health walk-in clinics were only available for Islanders who were over the age of 16. There was limited programming in rural areas, and virtual information and services may not be accessible to everyone. So this is our third of 4 recommendations. So screening, our recommendation is around screening youth using vaping products starting at age 12 for using evidence-based screening tools. So currently, the smoking cessation program uses the Ottawa model, and the Ottawa model really starts at age 18, and to my understanding, really screens adults starting at age 18. So though we are seeing very high levels of vaping and now continuing cigarette use among that lower population. So this is one of our recommendations. So from our literature review, we just wanted to highlight the Canadian Pediatric Society guidelines that came out in 2021, just endorsing the use of confidential screening for youth who are using vaping products starting at age 12 or earlier as appropriate, as unfortunately we see vaping affecting those younger audiences. Using some of the evidence-based screening tools that are currently out there and have been reviewed for smoking, and then adapting them for vaping discussion. And our final recommendation is to continue, is to continue to endorse nicotine replacement policy measures for youth protection. So, PI has really done a great job over in 2020 of having movement around the, age 21 to buy vaping products, the reduction to just tobacconist only stores, as well as our flavor ban. And I think that, being at some national level conferences, it really highlighted how important the work we've done here is, and how the rest of Canada has still not achieved some of those really great steps. But I think there's still more work to be done, and I'm just going to kind of highlight some of the evidence that we gathered through this project and how we can, further support some of that work. So in our survey, we found that right from those that responded to this question, which is about that 85 participants, less than 8% are currently using the highest nicotine concentration in their vaping products. When we compare this to data from our 2020 survey that found that 75% were using the highest concentration of nicotine concentration, that this is really great to see, right? We're seeing a big reduction in youth that are using that highest nicotine level. So with the majority of youth using the lowest nicotine level, which is currently legally available for purchase. So just wanted to highlight that. Also, we're still seeing a preference for flavored products. So 32% from our survey, preferred flavored juice if they were currently vaping. And I know these products aren't legally available in PEI right now, but unfortunately through social sourcing, the internet, and some on-reserve sales, we're still seeing quite a few youth using flavored products. So on this slide, we're just highlighting, the responses of those who these policy measures had made them vape less. So we have 42% reporting that increasing the minimum age to 21 had made them vape less. The flavor ban had also made them vape less, 36.5%, and also restricting the sale of vaping products to stores only had made the 25.6% vape less. So this is great to see. Again, we have a small sample size, but I think it does denote the importance of these policy measures in affecting positive behavior change among our youth. Now I'm going to pass it on to Abby. We're just going to quickly go over the findings from, as part of this project, we did a national non-smoking campaign to highlight the voices of youth. So she's just going to go over some of our findings.
Great. So yeah, as National Non-Smoking Week for our 2023 campaign, we had the theme as the voices of youth. So we'd use interview projects from our Exploring Youth Vaping project, took audio clips and samples from those and turned them into social media posts to share with our followers. So our two main channels that we used were TikTok and YouTube. And this is because, like Julia mentioned at the beginning, a lot of social medias have strict community guidelines about posting any nicotine related content. So Instagram and Facebook are pretty picky about what they want to see. So we found that YouTube and TikTok were the most effective in this instance. So for TikTok, We posted 2 quit stories. We posted Bree's story and Jonathan's story, and those range from 28,000 to 33,000 views. You know, over 1,000 clicks each. We're seeing almost 1,000 likes in both and over 100 comments. So this was really great to see youth engaging with the content we were making, whether they were commenting, I really relate to this story, I'm going through the same thing, or sharing tips about how they quit nicotine. So we found it was really inspiring to see youth comment and share their stories as well. In addition to TikTok, we posted Jonathan's full quit story on YouTube. So this got over 27,000 views, 10,000 engagements, and it had a 38% click-through rate. Again, we saw really great engagement with this, and it just made us realize that youth do want to see this content and realize that they aren't alone. And it was effective to use social media channels that they were most familiar with and using the most. I'm just going to pass it back to Julia, who's going to talk about our next steps.
Great. Okay, so as we're wrapping up our Exploring Youth Vaping Prevention and Cessation, we were very fortunate to receive funding for our next step of our project, which is called Engaging Youth Stakeholders in Youth Vaping Harm Reduction. So this is starting now, and we're going to go into 2024. This application was done in partnership with our co-applicant from the Faculty of Nursing, Dr. Allison Campbell. Her background is around knowledge dissemination, and she's done a lot of work around concussions on explaining the health effects to both parents and youth. So she's working in partnership with our current nursing students around doing an environmental scan of knowledge dissemination to help inform some of the products that we will be creating as part of our next project. So there's 4 components of our next project, and then we're going to wrap up for further questions and discussion. So our first component is providing education sessions on vaping and smoking products to adults both within the healthcare system and who work directly with youth. So this would be, we're going to be doing 12 sessions across the province starting in September. And later in the discussion, we'll be asking for some suggestions, but we're looking at, you know, teachers, we're looking at maybe dental hygienists, youth workers. So we want to travel to different areas of the province to provide a morning session that would kind of go over some of the background to youth vaping, as well as, you know, how to help support youth better. So our next component of our project is the creation of an interactive web-based tool to promote existing mental health programs and services available in PEI related to mental health and addiction, and to share our previous findings. So we will be creating a tool that will be on our website that, for instance, a teacher in Tignish could go on to say, well, I have a youth who's vaping and having some mental health issues around it. What services will be available in my community? So maybe there's a student well-being team nurse that she could connect with, and the asset map would kind of help her or them map that out a bit better. We'll also be producing a short educational video. This is only a few minutes long that we're looking to integrate and use on social media that would really show that scientific connection between nicotine addiction and toxic stress buildup. So we are going to be working with a videographer, and we're looking at sort of more of a cartoon model for this video. And that will be developed by the end of 2023. And our last component of this project is creating communication materials to highlight the stories of island youth who are successful in breaking their addiction to nicotine. So we're really looking at using the resiliency model to showcase, as in our video with Jonathan, who you can view on our TikTok and Instagram, is that, you know, we're really sharing how he overcame his addiction to nicotine and how his life is more successful afterwards. And I think that that's the type of story that really resonates with a lot of youth, as we found through some of the work we've done so far. And finally, our goal would be to build a network of stakeholders who have a vested interest in youth mental health and addiction, who we can work with to build best practice programming for island youth. So we're really looking at connecting a group of individuals through the next year about this topic, so that, you know, we can kind of work together on this, reduce some of those silos that are happening, and better connect services that might be available and the creation of new services. So that's it for our presentation. So